Good morning. Today we are going to study about the posterior compartment of leg. This is the cross section of the leg. You can see the two bones. This bone is the tibia and this bone is the fibula, and this is the interosseous membrane between the two bones. So this is the medial aspect and this is the lateral aspect. And the leg can be divided into three compartments by two intermuscular septa. So this is the anterior intermuscular septa and this is the posterior intermuscular septa. Between the anterior intermuscular septa and tibia and the interosseous membrane, this compartment is called the anterior compartment or the extensor compartment of the leg. Then between the anterior and posterior intermuscular septum, this compartment is called the lateral compartment. And between the posterior compartment and the bones and the interosseous membrane, this entire compartment is the posterior compartment or the flexor compartment. So there is an anterior compartment or extensor compartment, there is a lateral compartment or the peroneal compartment, and there is a posterior compartment or the flexor compartment. And the entire leg is enclosed by fascia cruris. The deep fascia of the leg is called fascia cruris. The deep fascia of the thigh is called fascia lata. Coming to the cutaneous innervation of the back of leg. You have already learned this nerve, that is the sural nerve. Tibial nerve in the popliteal fossa, it gives a cutaneous branch which is called sural nerve, and a branch from the common fibular nerve, that is sural communicating nerve, joins with the sural nerve, and it is this nerve, the sural nerve, which is going to supply the back of leg, and also the lateral aspect of the lateral border of the foot is supplied by the sural nerve. This is the posterior compartment or flexor compartment, and it is further divided into two parts, into a superficial part and a deep part by this fascia, and that fascia is called the deep transverse fascia. So the deep transverse fascia divides the posterior compartment into a superficial part and a deep part. So now we will see each part and the muscles seen in each part. What are the muscles seen in superficial part? These two muscles are the gastrocnemius muscles. So this is the medial and the lateral head of gastrocnemius. Then deep to the gastrocnemius you have this muscle, this large muscle, that is the soleus muscle, and you have this small muscle with a small fusiform belly and a long tendon, and that is called the plantaris muscle. So these muscles are the muscles in the superficial part. So that is the gastrocnemius, soleus and plantaris. So this is the gastrocnemius. The medial head and lateral head are arising from the corresponding condyles of femur, from the posterior aspect, from the popliteal surface of the corresponding condyles of femur, and they will join to form a broad aponeurosis over here. And this along with this muscle is soleus muscle, it will join and they will form the triceps surae, and it will get inserted into the posterior surface of the calcaneum. Soleus is called so because it is sole shaped. It has a horseshoe shaped origin, an extensive origin from both the bones. This is the origin of soleus from the fibula, and this is the soleal line. Soleus is taking origin from the soleal line and also the medial border of tibia. So this is the origin of soleus. Okay, and between the two bones there is a tendinous arc underneath which all the nerves and the vessels will pass from the posterior aspect of fibula and from the soleal line and the medial border of tibia. The soleus is taking origin. It is a multipennate muscle, and it is getting inserted along with gastrocnemius to form the tendocalcaneus. That conjoined tendon of the triceps surae is called the tendocalcaneus, and that is going to be inserted into the posterior surface of calcaneum. Soleus is called peripheral heart because within the soleus muscle there are various venous sinuses which have no valves, and these are actually perforating veins. The soleus muscle is pierced by perforating veins that drains the blood from superficial muscles to the deep muscles, and they are arranged in the form of venous sinuses within the soleus, and they do not have any valves. So when soleus contracts, these veins are squeezed and the blood column will flow upwards against gravity. So it helps in increasing the blood flow towards the heart. So this is like a peripheral heart. So that is why soleus is called peripheral heart. Plantaris, it has got a small fusiform belly. You can see it is taking origin from the lower part of the lateral supracondylar ridge, and it is forming a long narrow tendon. This long narrow tendon is passing between the gastrocnemius and soleus, and finally it will blend with the medial aspect of the tendocalcaneus. Because of this long tendon, fresher students, the first year students who are doing the dissection for the first time, most often mistake it for a nerve. So that is why this is called freshman's nerve. It is called the freshman's nerve. The distal part of plantaris represents the plantar aponeurosis. It's just like how we have a palmar aponeurosis in the palm, like that you will be studying in the sole. There is an aponeurosis which covers all the vessels and the nerves and the muscles. That is the plantar aponeurosis. So the distal part of plantaris forms the plantar aponeurosis morphologically. What is the action of triceps surae? The two gastrocnemius and the soleus together form the triceps surae, and the conjoint tendon of triceps surae is tendocalcaneus. The triceps surae is a strong plantar flexor of the ankle joint. And since gastrocnemius and plantaris are taking origin from the femur, so it is crossing the knee joint, so they will have an action on the knee joint, that is, it will help in flexion of the knee joint. So gastrocnemius and plantaris will help in flexion of the knee joint. The gastrocnemius and soleus will help in plantar flexion of the ankle joint. Now coming to the deep part. In the deep part there are 4 muscles. That is, 1 muscle above the soleal line and 3 muscles below the soleal line. So you know this is the soleal line of tibia, and above the soleal line you can see this muscle, that is the popliteus. It is actually the insertion of popliteus. You have already seen popliteus forming the floor of popliteal fossa. And below the soleal line there are 3 muscles: flexor digitorum longus, the flexor hallucis longus, and tibialis posterior. So flexor digitorum longus is taking origin from the tibia. Flexor hallucis longus is taking origin from the fibula, and tibialis posterior is taking origin mainly from the interosseous membrane and from the adjacent parts of both the bones. The tibialis posterior is in a more deeper plane than these 2 muscles. This is the popliteus muscle and this is the tibialis posterior. These 2 muscles, they lie at a skeletal plane, so they are the deepest muscles. Popliteus is a very important muscle. It can be asked as a short note. So popliteus muscle is taking origin from inside the capsule of the knee joint. So it has an intracapsular origin. So that is taking origin from the lateral condyle of femur inside the capsule. This is the capsule of the knee joint. So it is going to pierce the capsule in the posterior aspect and it is going to come out, and the insertion is fleshy. So it is taking origin as a tendon and the insertion is fleshy onto the posterior aspect of the tibia above the soleal line. So that is the popliteus muscle. Few fibers of the popliteus muscle, before it comes out of the knee joint, it is going to get attached to the posterior horn of lateral meniscus. You will be learning this in the knee joint. So this is the lateral meniscus, this is the medial meniscus. Few muscular fibers from the popliteus is going to attach to the posterior horn of lateral meniscus. This fibers, it will help in pulling the lateral meniscus backwards at the beginning of flexion. From an extended knee, you want to flex your knee. So at the beginning of flexion, you don't want the lateral meniscus to be trapped between the femoral and the tibial condyle. So for that, the lateral meniscus has to move backwards, and that is by the popliteus muscle. So it saves the lateral meniscus from being crushed between the 2 condyles. At the beginning of flexion from an extended knee, there is a process that is called unlocking. Details of that you will be learning in the knee joint. So it is also called the unlocking muscle. Popliteus helps in unlocking of the knee when the knee begins to flex from an extended position. In an extended position, the knee is locked. At the beginning of flexion, there is unlocking of the knee, and that is done by the popliteus muscle. Muscles below the soleal line, you have the flexor digitorum longus, flexor hallucis longus, and tibialis posterior. So flexor digitorum longus, from the posterior aspect of tibia below the soleal line, you have the origin of the flexor digitorum longus. This is the origin of flexor hallucis longus, that is the lower aspect of fibula, and this is the origin of the tibialis posterior. Mostly it is taking origin from the interosseous membrane and origin from the adjacent sides of both the bones. So flexor digitorum longus, from the name itself, flexor digitorum longus, it is going to the sole of the foot, and then it is going to divide into 4 tendons, and it is going to get inserted into the base of the distal phalanx of the lateral foretoes. And flexor hallucis longus will go to the terminal phalanx of big toe. So what will be the action? They will help in plantar flexion of the ankle joint as well as the distal phalanx. The plantar flexion of the big toe is done by flexor hallucis longus, and the plantar flexion of the lateral foretoes is done by the flexor digitorum longus. And both of them will also help in plantar flexion of the ankle joint. This is the tendon of flexor digitorum longus. It is going to pass into the sole, and it is going to divide into 4 tendons. Whereas flexor hallucis longus, it is grooving the posterior aspect of talus. This bone is talus. You have already learned the tarsal bones. So this is the talus, and it is going to groove the posterior aspect of talus, and it is passing beneath the sustentaculum tali. Shelf-like process that is seen in the medial aspect of calcaneum. Below the sustentaculum tali, there is a tendon that is grooving on the undersurface, and that is called the flexor hallucis longus. This is often asked for osteology. When you are given the calcaneum, you will be asked to identify the sustentaculum tali and what is the structure grooving below it. Tendon of flexor hallucis longus will groove beneath the sustentaculum talus. So tibialis posterior is having an extensive insertion. Most of the tendon is getting inserted into the tuberosity of the navicular bone. So this is the talus, this is the navicular bone, boat shaped navicular bone, with the tuberosity in the medial aspect. Most of the tendon is getting inserted into the tuberosity of the navicular bone, and after getting inserted into the tuberosity of the navicular bone, it is giving so many extensions to most of the metatarsal bones and most of the tarsal bones. It is going to all the tarsal bones except the talus. So tibialis posterior is getting inserted to all the tarsal bones except the talus. You must have learned when you learned about the tarsal bones, talus is the only tarsal bone which receives no muscular attachment. So tibialis posterior is sending extensions to all the tarsal bones except the talus. This is very, very important. Primary insertion is to the tuberosity of the navicular bone, and then it is sending extensions to all the tarsal bones except the talus. So what is the action of tibialis posterior? So tibialis posterior, like the other two, it will help in plantar flexion of the angle joint, and it will groove the posterior aspect of medial malleolus. Since it is seen in the medial aspect, tibialis posterior also helps in inversion of the foot. Inversion of the foot is done by tibialis posterior and tibialis anterior on the anterior aspect, with the sole facing downwards and medially. So the other two muscles have plantar flexion of the angle joint and plantar flexion of the big toe and the lateral toes. And tibialis posterior action is plantar flexion of the angle joint and inversion that is occurring at the subtalar joint. Coming to the nerve of this compartment. So the nerve of this compartment is the tibial nerve, the sciatic nerve, the upper angle of popliteal fossa. It is going to divide into tibial nerve and common peroneal nerve. Common peroneal nerve will pass into the lateral angle. It will wind around the neck of fibula, and it is going to divide into superficial and deep peroneal nerve. But tibial nerve will extend down from the upper angle to the lower angle. It's superficial to the popliteal vessels, and it is going to enter into the posterior compartment beneath the tendinous arch of the origin of soleus, and it is going to give branches to all these muscles. So the branches of tibial nerve in the popliteal fossa, we have learned the two heads of gastrocnemius is supplied, and plantaris is supplied, the soleus is supplied, and also the popliteus is supplied from the deep aspect. All these muscles are already supplied in the popliteal fossa. When it reaches the posterior compartment, it is a deep muscle that is supplied by the tibial nerve. So we have got flexor digitorum longus, flexor hallucis longus, tibialis posterior, and also soleus. Soleus is again supplied by the tibial nerve from the deep aspect in this posterior compartment. So the nerve to popliteus has got a peculiarity that is often asked as a spotter question. Okay, what is the peculiarity of the nerve supply to the popliteus? The nerve to the popliteus is supplied from the deep aspect of popliteus, from the inner aspect of popliteus. And this nerve, after supplying the popliteus muscle, it is going to supply the superior tibiofibular joint, the interosseous membrane, the inferior tibiofibular joint, the tibialis posterior, and it is going to give a medullary branch to tibia. So popliteus is supplied from the deeper aspect, and after supplying the muscle, it is also going to supply the joints, superior tibiofibular joint, the interosseous membrane, inferior tibiofibular joint, the tibialis posterior muscle, and a medullary branch to tibia. So that is a peculiarity of the nerve supply to popliteus. This is very important, and it is giving articular branch to angle joint. So the articular branches to knee joint was already given off in the popliteal fossa. We have learned about the three genicular branches. In the posterior compartment, the tibial nerve will give articular branch to the angle joint, and it will end by dividing into medial and lateral plantar nerves. When it reaches the flexor retinaculum, it is going to divide into medial and lateral plantar nerves. One more branch is there for the tibial nerve, that is this branch. This small branch that is given here, it's a cutaneous branch. It will pierce the flexor retinaculum, and it will supply the skin over the weight bearing area of the heel. This branch is called medial calcaneal branch, and that is given off by the tibial nerve. So these are the branches of the tibial nerve in the posterior compartment. The artery of this compartment, we have the posterior tibial artery in the popliteal fossa. The popliteal artery at the lower border of popliteus will divide into anterior tibial artery and posterior tibial artery. Anterior tibial artery will pass over the interosseous membrane into the anterior compartment, and the posterior tibial artery is the artery of the posterior compartment. This is the posterior tibial artery. It is giving a branch over here. This branch is called the peroneal branch. This peroneal branch is the artery of the lateral compartment. It is going down and it is going to enter into the lateral compartment. Posterior tibial artery will give muscular branches to all these muscles, and it will give the nutrient branch to the tibia, whereas the peroneal branch will give nutrient branch to the fibula. In the posterior tibial artery, it gives branches to form a medial malleolar network, and finally it ends just like tibial nerve under the flexor retinaculum to form the medial and lateral plantar arteries. So this is the peroneal artery. The entire thing is posterior tibial artery, and that gives a branch that is peroneal artery, which is the artery of the lateral compartment. So flexor retinaculum Modifications of the deep fascia. Fascia cruris, a modification in the lower aspect, in the medial aspect, is called the flexor retinaculum, that is attached from the calcaneum to the medial malleolus. It is to keep these tendons in position and to prevent the bowstringing of these tendons. So these tendons are passing in an order from medial to lateral. First tendon is the tibialis posterior, that is grooving the posterior aspect of the medial malleolus, tibialis posterior. Then you have the flexor digitorum longus. Then you have the artery, that is the posterior tibial artery. Then you have the nerve, that is the tibial nerve. Then you have the flexor hallucis longus tendon. It is going to form the groove under the sustentaculum talus. You have the code Tom, Dick and Harry. So T stands for tibialis posterior, D for flexor digitorum longus, A for posterior tibial artery, N for the tibial nerve, and H for the flexor hallucis longus. So you palpate between the medial malleolus and the calcaneum, you are going to get the pulsations of the posterior tibial artery. Thank you.